starting the side lying with stones, and we do first the upper body. We see if it's not too much for you, I'll do also the lower body. Again, bend the client legs, shuffle them a little bit close to you. That's good. Pillow. Actually, if you can come around here, and you see that most of the pillow is on the back. This should be something like that. So most of the pillow should be in the front. Why? Because the tendency of the head is to fall forward, right? So you need to be having more of the pillow forward, so the head would be stabilized. Yeah. Okay. Then we are ready. You can work on the spine just by, putting the towel this way, but I will do most around the shoulders and the neck. Yeah. Okay. So we'll start with the neck and shoulder. Yeah. Okay. Down. Ooh. Oh, the stone is there. The stone is there. There. So again, because it's after lunch break, put it on high and get ready. I will start with the neck stones. Yeah. So just remember oil to start with. Quite hot, yeah? Quite hot. We'll wait another 2 seconds. Fine. Drop it. Good. And now you pretty much need a lot of rolling, because the stone is quite hot. Can I give you, and you feel the heat of the stone, yeah? Yeah. Quite quickly. Pass it quite quickly from one person to another one. Yeah. I just want you to feel the heat. So you kind of get an idea that it is hot, yeah? So that means that I would need to really move it quite quickly.
I should actually.
Now it's a little bit better. We're doing again the 3 position. So I would start from that side. Yeah. It's a little bit harder because the flipping should be done in one hand. Yeah. Again, if you feel that it's too much, then flip it here. So really safety is the most important thing. Good. If you want to come around and see, getting very nicely into the suboccipital area. Good. If you want, you can still do what I did. Just be sure that you really feel the spine where it is. Yeah? Remember that we did similar to. So really the hot stone really mimic the other technique. It's not a technique by itself, it's just you're using stone instead of thumb or else. Yeah? You can work nicely on the levator scapula. This area, for example, nice compression. And it's great because it's really minimal effect from your body needed to. Yeah, you can find the bony landmarks. How's the pressure? Yeah. Can I go deeper? Yeah, it's okay. Good. Then Few other techniques that we might not do much. First of all, the infraspinatus. So if you want to feel that, go and feel the lower angle of the scapula, and the scapula goes that way. In between the scapular surface, there is a muscle that's called infraspinatus, and for one way or another, might be quite tender. Yeah. So the easiest way is to come from laterally onto it. It would feel like a ridge. So if you want, feel it without the stone. So that's the lateral side of the scapula, and then go a little bit there. Okay, here it is. Yeah, and it can be very, very tender. Yeah, or you can just massage on the surface of the scapula, because really the surface of the scapula has muscle, and this muscle go to the it's one of the rotator cuff muscle. Good. Another nice technique is to put the arm this way, and then in the space in between the spine and the scapula, put the stone, and then it's a kind of mobilization, compression together. Mobilization because you're moving the spine, but at the same time you're working on the erector spinae. Or even you can do it on the other side, just drop the shoulder backward. So it's a really nice for office workers that all the time would be in a protracted kyphotic position, just stretching that. Or you can do it on the other side. I feel that on my client now, the space in between the scapula and the spine, when I do that, closes. So I can't put the stone there. I can put the stone on the lower erector spinae. Okay.
So you put it on erector spinae, so...
Here now, I just put the stone onto her hand, inside, and then I move on to take another stone. Sorry, what was that?
I was going to say, you put the scapula into the stone. You push the scapula into the stone.
Yes. Yeah.
Instead of lifting it up.
Yeah. So I'll bring it into the stone, and then use the movement of the shoulder onto.
You drop it down.
Coming from here, would be really nice to roll the stone this way. Or on the spine itself. You can work on the spine, pretty much like what we did side lying anyhow. You can put a bit more pressure down, yeah. And now from here, take the stone down, and you can do again a bit of mobilization, a bit of hot stone. You need quite a lot of rolling here, and it's a small space, so it's quite hard. You know, you do a lot of things together, and it might take you a few months to get kind of a comfortable way. So, you know, they always have the fallback of the video. Good. Right away into compression. Yeah. All right.
Mm-hmm.
Can we move on to the lower
Yeah.
lower part of the body? I think it's because we've done it before. Yeah. Cool. Here you can give them the stones, and now it's more into bigger stones. Yeah. So you could. When draping, it's pretty much the same draping. You can just put this towel onto here, and you create kind of a cradle around. Yeah. nicely tuck this under, yeah, and then you are really lifting it. Thank you. You're really ready nicely to go. This would be a fantastic place to work from tensor fascia latae here, a gluteus, maybe a little bit of minimus, although it's deep, medius and gluteus maximus, hamstring, iliotibial band, quads, a lot of muscles that are quite neglected many of the times. Good. I think that mostly on the lower limb, large effleurage would be nice. Now, it feels quite hot, yeah? So you can do one hand this way and then moving this. It's almost like, when you think about it, it's almost like a U around the greater trochanter. So you can do that U. It's quite tender, or it's okay?
This is okay.
Yeah, it's all right, okay. Quite small. Be careful on the knee. There are two bony landmarks that you have to be careful. First is the knee joint itself, and a little bit below is the head of the fibula, yeah, which is located here. So those two are quite similar, quite close to each other. Good, again, you can do a nice joint mobilization while you're doing it. Yeah. Good. And work fairly deep onto here with the tilting. Be careful, and many people would be quite sensitive. Yeah. Gluteus maximus. Yeah. You can do that from the side, from this side. Gluteus medius the same. What I find that while I do that, after it's heated up, then I use my hand. Because when I close to the scapula, I have to be quite careful with the bony landmark. So just be aware about how much you can go. Yeah? Okay. One last area, and quite important, is the QL, yeah, quadratus lumbarum area, and need to put this one off.
Pares my
Area. And what you can do is actually reflect this onto that, so you can work nicely onto the lower back. Again, the stone I would use is, you can start with large effleurage, but we see that here there are big variation between people, especially male and female. The male hip is a lot higher, and that means that you have a smaller space here. Woman hip is a lot wider, so that means the space between the lower ribs and the hip is a bit bigger. So sometimes it's quite hard to, you have quite a small space to work on to the quadratus lumbarum, you can start really working that way. Quite sensitive to the iliac crest, yeah? And you can link it always to the gluteus medius or maximus. Now, when it comes to the QL itself, it's actually quite hard to reach into the whole muscle. You can't reach to the whole muscle. So if you imagine this is the skin, then after the skin is quadratus lumbarum, and behind quadratus lumbarum is the QL. And the QL is quite thin muscle. It's like the diaphragm. So when you coming and palpating, you can touch this area, maybe a little bit here and a little bit on the back, but you can't go all the way. This is one of the reasons that movement on the hip would be quite good, yeah? Because the quadratus lumbarum attached to the hip here, and to the lower ribs here, and to the spine here. So this is the only free area, and what you're doing is actually kind of give it a bit of a pump, sorry, a bit of a pump by slacking it, stretching, slacking and stretching. So now working more on the slacking. Yeah? And now you can work a little bit more on the stretching.
So the QL is being stretched. What other muscle? The
rectum spinal as well. If you want to help it, you can just straight the upper leg, and it will be helping in the stretching. Yeah. Do you see what happened to the muscle here? Slacking, stretching. Yeah. So there is not much else you can do into the QL. You can't just go from here because that's the erector spinae. So you can do it from the other side as well. Nice thumbs in here to how much it allowed. Yeah. And here I do more of the stretching. Yeah. You can also work on the lower ribs. You can kind of with one hand mobilize them.
Is the psoas muscle in there?
The psoas would be in front.
Would that have an effect on the stretching?
It will have a minimal effect. The more stretching would be the extension of the hip. Yeah. So, hot stone, quite superficial, and then more of specific work. It is an area with quite a lot of bony landmarks. You cannot work free. You can warm it up, and then that's it. The rest your hands needs to do. It's quite sensitive into here. Any question? So remember, we started with the neck, shoulder, and then we did the whole of the side of the lower body, and then at the end, QL mostly. You know, you can work on the sacrum as well here, you know, with the knuckles. Yeah. But let's leave it like that, okay? So